Hey, welcome.
We're live?
We are live. I have Dr. Paul Thomas on my channel. This is the most exciting thing. And you people will be commenting and saying hi to Dr. Paul Thomas because a lot of you know him because I talk about him all the time. Tell him how I talk about him all the time. Tell him it's true. I'm not just saying it. So
you guys, this is my first ever live YouTube thing. So he's teaching me a new trick.
This is awesome.
This is
Let me
great.
set this up here a little bit taller. And what are we supposed to say?
Something stupid, he said.
Something stupid. What?
Yeah, that's
so
my producer.
This
Don't say anything.
don't say anything stupid. Okay.
Oh yeah.
Don't mess him up, Dr. Vaughan.
Oh, look, it's
Oh,
Noah.
there it is, it's Noah.
Big no-no.
Big no-no.
Big no-no.
Now
So,
I feel flattered all
yes, make sure to see Big No-No's channel too. Okay, so look, BooBoo Kitty, oh my gosh, hi, and Pamela Shrake. Hi, Dr. Paul, my favorite pediatrician, Teresa D. Hi, doctors.
Oh, that's nice. Thank you.
This is like big numbers here for me for live YouTube. But
That's
you
crazy.
get all of this interaction. I'm teaching them about it. Oh, look, Regina's here. Omar's my guy who helps. He actually runs a fan Instagram for my channel.
Okay.
He puts up Instagram pictures.
Wow.
So as these come up, and Regina, hi, she's really excited. Fran, OMG, two favorite YouTubers
Oh,
from
thank
Melbourne,
you.
Australia.
No way.
Isn't that cool?
That's ridiculous.
You've got to start doing
That's ridiculous.
this. Jake Bauer, hey guys, y'all are great. Claire Barney Dog, hi, nice to see you guys together. Drink Mix, hi doctor, good to see you again.
Wow.
Franti, hello. Butterfly Girl,
Wow.
Dr. Paul and Dr.
So
Vaughan.
you guys know this guy drove up from Auburn, California, about 700-800 miles to come see me up here in Portland, Oregon. I feel very honored.
Finally,
And,
I get to
you've been
collaborate
trying to,
with
yeah,
Dr.
you've been
Paul.
trying to get up here for a while, so this is very exciting.
Yes.
Yeah, we have very similar philosophies, very similar styles when it comes to
Yeah.
how we present medicine on YouTube. We try to be real, right? And
Yeah.
I like how you do that.
much we can.
Yeah, I like how you do that. So that's good.
So we get all these comments here, and you can interact with them. You can ask questions of them, and they'll talk to Dr. Paul. I really enjoyed a day in the life of pediatrician vote.
Oh, thank you. That
Yeah,
was a
see?
big day.
Told you I had
Yeah.
some people who watch
Yeah,
it.
that was a big day.
Yeah.
Yeah.
Boo Boo, let Dr. Paul live.
Yes.
No. Oh no.
Live, live. I need glasses. So
IKR is I know, right?
Yeah.
See, I'm with it.
Okay.
I know how to not use punctuation on
Yeah.
texting now.
All right.
And
Good.
you used an emoticon today.
I did. What's an emoticon?
Who texted me?
Oh, that was me.
Okay.
Okay. I use things that I don't know what they are.
Okay, and now I want to show you something else that's
Okay.
on it. For the sake of Dr. Paul, can somebody do a super chat so I can explain what that is to him? Okay, you see how these comments just start pouring in?
Okay.
People telling you what part of the country they're from.
Yeah.
And they'll have these comments, and you want to get to them, but sometimes you just can't get to all of them. They have the capacity on YouTube to, when they put in their little chat conversation, to hit a little $sign
Yeah.
and give a monetary amount.
Okay. So
And that one gets
goes to
outlined.
the top.
And it stays on for a while, according to how much
Okay.
they paid. So you can give them special attention, and then everybody thanks them for contributing to
Oh, okay.
to the program
Gotcha.
because they enjoy it and we enjoy it, and so
Yeah.
everybody enjoys them helping make it possible by
Okay.
giving something. So somebody do a super chat so I can show Dr. Paul what it's all
Somebody
about.
asked, will you link to Dr. Paul's channel?
Absolutely.
That's the plan. We're going to put together some joint playlists in the near future.
Joint playlists.
We had a
Playlists about joints? Oh no, that'll get this demonetized.
That's ortho. No, we're going to stick to general medicine, not orthopedics. Yeah. Or were you thinking these
I was
joints?
Say,
No,
the
no,
orthopedists twist them at the end.
Yeah.
Oh, look! See, Pamela.
Oh,
thank you.
Thank you, Pamela.
Thank
So
you for
that's
showing
what a
us how
super
this
chat
works.
looks like.
Now we know. Pamela showed us
okay. All right.
super chat. So
That's amazing.
that's how you get noticed on a really busy chat on one of these live YouTubes. Is
Gotcha.
you just throw in a little
Gotcha.
super chat, and you'll get your question. You'll get attention.
So, Pamela, do you have a question for me?
Absolutely.
Go
What
ahead
is
and
your
fire
opinion
away.
about the pain med overdose? Somebody loves Pamela. Thank you, Pamela. Everybody's thanking Pamela.
Yeah.
Teresa, yes, Payne, Cheryl McNutt, for joint channel. Well, we don't have a joint channel. We're putting some joint things together,
We're
like
going to make a playlist of earwax,
playlist, yes.
playlist awards,
Yeah.
some of the things that are most popular. But,
Games of Thrones. No thanks. What can be done in yeast in the chest? Yeast in the chest. That sounds like that sounds like a problem. Doesn't
Yeah,
it?
if you have a fungal infection in your chest, that's
not
probably
good. Like valley fever. or-
heavy duty antifungals.
Pamela. Oh, she doesn't have a question. She's just enjoying the two of us together.
Thank you, Pamela. That's
Pamela,
really sweet.
That is cool.
That's
we
great.
really appreciate it. Oh, Butterfly Girl. Watch you all the time, Dr. Paul. See, one of my
Thank
people
you.
watches you all the time.
Yeah. That's awesome.
So now I'm feeling like I'm not going to get you that many new subscribers
No,
because they already all watch you.
No, it's all good. It's all good.
So if you guys don't already see Paul Thomas MD, search for it on YouTube and subscribe. You don't even have to look at it. You already know you like it.
I love my
because
children too. Somebody said, "I love your children, Dr. Paul." All
Yes.
10 of them.
Oh, that's right.
Yeah.
How many? You've shown a number of them on
Some
your
of them,
channel.
yeah. And they're really darling when they're asleep.
That's when we love our kids.
That's yes.
when they're not talking.
When they're sleeping.
When they're not saying, "Can I have the keys?" Okay, I have a wart on my finger, and we're gonna have a wart joint.
We're gonna have a joint playlist for warts.
Of warts.
Yeah.
Gotten frozen multiple times. It hasn't come off. What should I do? Hey, let's actually talk about warts for GBAG 998.
So the resistant warts are tricky. I mean, you sometimes got to keep freezing and even deeper. I know dermatologists will sometimes use beetle juice, and they'll stimulate the immune system that way. There's the whole thing about duct tape. You read that article?
I actually tell patients, go ahead and do the duct tape. Apply it twice. I say twice daily.
Yeah.
Take it off and rub off whatever's dead there. I'll often tell them to combine it with over-the-counter wart remover.
Perfect.
Some salicylic acid.
So the most resistant wart we had in my family, one of my kids, we couldn't get rid of it. I froze it. My next door neighbor brings over a little bottle of Dr. Scholl's Clear Away or something like that, just a little oil, and we applied that nightly, a couple applications, let it dry, and covered it with duct tape.
Yes.
In the morning, you just took the duct tape off, kid goes about his day, and the next night we did it again. By the end of the week, that wart was gone.
Wow, that quickly.
The neighbor cured the doctor's kid who couldn't cure his own kid. Give it,
I had to do it for over a month, maybe even 2 months for one that was right here.
Yeah.
And that's what I did. I just kept applying the over-the-counter wart remover twice daily, rubbed off the dead keratin that was there. Also, we will sometimes cut them out. We'll use local anesthetic and pair them out with a curette.
We used to do that with molluscum.
Yes.
We used to get those out with
But I
the
prefer
curette.
not to. I prefer to either
It's
use
scarring.
nitrogen or have people use home treatments with over-the-counter. So thanks for that question.
Yeah,
That was,
good question, and we seem to be in agreement there.
keeps getting strep, Dr. Paul. He's 9. I give him probiotics. I'd like to avoid tonsillectomy if possible. Any thoughts on that? Any quick?
Recurrent strep. Hey, I just learned something. I'm an integrative medicine doctor as well. I'm going to give you a little tip that worked for my chronic sinus infection, and that's something called Argentin 23. You can purchase that at over-the-counter at integrative-type pharmacies. Argentin 23, get the spray. Just spray that in the back of the throat several times a day, and that might actually take care of it. It's very good at clearing bacterial and viral infections. It won't harm the host. Give that a try. Every once in a while, if there are really large tonsils and there's pockets of infection, there are those rare kids, right, or even adults who need tonsillectomies.
It does happen, sadly.
But you may be able to avoid it that way. The other integrative thing that's worth trying is get off of foods that are causing a lot of reactive tissue, the tonsils, the adenoids, the lymph system, and that would be dairy and gluten. Sometimes getting off those things helps.
About how long would it take for a person to know if that's
so the food change, it's got to be about 3 months, 1 to 3 months minimum.
Wow. Both of them at the same time.
I would do both. I mean, if you're looking at preventing surgery, go all out. But try that Argentin 23. It cleared my sinus infection that had been there for decades.
Okay. And then what else do we have? Doctors, what can I do for burning mouth syndrome? Oh, boy. Are you familiar with that?
No, tell me about it.
Oh, they'll just have the sensation of burning. It seems to be some kind of like a CRS. That's not that you can't remember the stuff. It's what is it? Like regional dysesthesia. What's the term I'm trying to come up with? They changed the name of it. Regional reactive.
It's just a neurologic thing.
There's a name for it. We used to call it, and they changed it.
It's on the tip of my tongue. I know what you're talking about. Oh,
the autonomics go off, and there's sweating, and
anyway.
Well, now it's killing me. And I can't come up with it.
So you think that's
You
a
have something
neurologic
for memory?
thing? For memory? Yeah. Ginkgo, ginseng.
Yeah, it seems to be similar to that, and I believe it responds to the anti-epileptic medicines like the gabapentin and the Lyrica. Some people will get good relief with benzos. Of course, I often try to discourage people from going down the benzo path.
Don't go to the benzo. I'm an addictionologist as well. I'd avoid that. So you know what? If you've got something neurologic going on, you want to try some natural things, I would get methyl B12. B12 can affect things that are on the nervous system. The other thing is vitamin D. So many people are severely vitamin D deficient, and high dose omega-3 fatty acids. Those would be the natural things I would do first, and then go see your doctor if it's still getting worse.
Okay. And minimal risk to those things. The only thing I can think of would be if somebody had a problem with coagulation, the fatty acids possibly.
High dose fatty acids.
But if you don't have any problems with that, you're not going to have any problem with anything you just said.
Yeah.
Yeah. Okay. What else do we have there? Dr. Thomas, your video's a long time. Remember the one with the car accident? Yeah, that was right out
the window here.
Right on that road there. Yep.
Yeah. This guy recognized this location. He goes, "Oh, that's where the car accident was." I'm like, "Man, you really know my videos."
I'm a fan. I told you.
That's impressive.
That's right. Regina, I got 12-hour day. Got to sleep soon. Got to work at Peds Internal Medicine. Any suggestions? Periodic limb movement disorder. Ooh, at 39, periodic limb movement disorder.
So I don't know a lot about that. If it's restless leg related,
It's similar to restless leg.
I know with restless leg, magnesium is amazing.
Yeah.
So
And some people, you'll find that their iron level is low, and then if
Yeah.
you replace that, it takes care
Yeah.
of it.
So you might try that.
All right. Okay.
I think we call it a wrap.
Okay.
Yeah, I've got to get up at the crack tomorrow. I'm starting my day at 5 in the morning tomorrow, so
Yes.
we're going to keep this one short. Thanks a lot, Dr.
But
Mark.
It was good to show you
that
what
was great.
live YouTube
yeah,
is like.
It's fun to do it. And your battery's dying,
And
so
my-
there we go.
They're used to that happening.
They are? Okay.
And so what will happen is we'll put this out. Well, it'll actually be out right now. As soon as it stops, people watch it. We'll get 1,000, 2,000 views on it within the first 48 hours.
Interesting.
Yeah.
Very good.
All right. Hey, thanks for joining us.
Thanks
Until
for
next
watching,
time,
everybody.
Dr. Paul, what's your sign off?
Oh, thanks for watching. I'm Dr.
That's
Paul.
right. That's right. That's
Yep.
it. Okay. And Dr. Mark Vaughan telling you to stay in good health.